good. We will start. I don't know if you want to stand, sit.
Sit, I think.
Okay.
Okay. Good morning, everyone. So my name is Sekayi Tangayi, and I'm a consultant nurse in Sickle and Thalassaemia at North Middlesex Hospital. And I've been asked to talk about the Royal College of Nursing caring for people with sickle cell disease and thalassaemia syndromes. It's a framework for nursing practice. I would like to thank Natasha Lewis. She's a consultant nurse at Homerton Hospital, and John Walters, who is also a lecturer at
Oh, it's not like that on the laptop.
So. Hold on. Lost the plot.
Just talking about John.
John Walters is a lecturer at King's College, and she lectures in sickle cell and thalassaemia. So just to give you the context of how the competencies actually started, this was a younger me at Newham Hospital in Beckton Ward. And I did work with Dr. Emma Drosser at that time.
The health officer.
Please don't ask how old we are. I've worked I've done many jobs in my lifetime, but the ones that were really key was working in general hematology. Then I worked as a clinical nurse specialist in heme oncology. Then I worked as a sickle cell and thalassaemia CNS, and then I became a service manager and lead nurse for Newham in East London for 15 years. I am now a consultant nurse at North Middlesex Hospital, but however, the reasons why the current nursing competencies actually came about, having worked in heme oncology, I don't know if anybody's ever worked in oncology, you have what are called nursing competencies, and I think at the time they were called something 2000, and you actually had to complete those competencies to then be accredited or be acknowledged that you're actually a competent oncology nurse who's able to give chemotherapy and look after patients on the day unit or on the ward, wherever you are. So when I actually came into sickle cell, I think that was 1998. I was very surprised that there wasn't anything that was actually used to benchmark the nurses who were actually working in practice with sickle cell. So that kind of really concerned me, because we have issues in nursing whereby patients are constantly complaining about nursing care. And so we're expecting nurses to work in practice, but we don't have a tool to actually benchmark that practice. This is how the competencies came about. It wasn't easy getting the competencies together because at the time, I think I was fairly new in sickle cell. I had to convince people that this is what needed to happen. And at the time, I didn't even realize that it cost money to actually put everything together. So I needed to get some money. So I managed to get money from what was called the NHS screening program at the time. And that's how the document was put together. Okay. So the objectives of the competency framework for this particular competence framework is to improve the quality of nursing care to patients affected by sickle cell disorder and thalassaemia syndromes, and also to help and develop a nursing structure for nurses. I think when I first came into Sickle, we didn't even have band 8s, now we do. I think everybody's banding stopped at band 7. And in order for you to actually move to band 7, to band 8, you had to fight for it. And we're still fighting for these positions. And in this country alone, we only have 3 nurse consultants. Why is that? Other professions have more than, across the whole country, but we have 3 consultant nurses. And this is not something that has always been existing. This is new. I think for the last 5 years or so, we only had 1 nurse consultant in Sickle. So I'm the second, third, actually, the 3. Yeah. So why is it important to focus on nursing careers for sickle cell, and why is it important to focus on benchmarking the care for sickle cell patients as well? It's stories like these that has been on the news media that kind of worries us. I think the top story, I don't know if many of you actually remember this young girl. Her name was Sarah Malunga, and she lived in Barking. And this wasn't a nursing issue, but the fact that the ambulance actually left her the first time because she'd soiled herself. And when the paramedics came the second time around to pick her up, she'd actually subsequently passed away. So, and that was just lack of understanding of sickle cell, that things can actually happen quite rapidly. A patient can walk in and you think that actually they look okay, it's our regular patient. They normally have the analgesia, and we run around not realizing that something medically or clinically could actually be wrong with them. The gentleman in the white shirt, actually, it's a very old story of a gentleman, I think from my reading or understanding, in the 1987 or 85, he actually called an ambulance from a ward saying that the nurses were refusing to give him his analgesia and oxygen. And then we now come to recently, I think this was 2019, where Evan Smith exactly did the very same thing. He called an ambulance from his hospital bed saying that the nurses were refusing to give him oxygen and he wanted to be moved to another hospital. So just to cut it short, it's things like this that you start to think, why are these happening and why is it always nursing? And so you start to think about, could it be attitudes and behaviors? And unfortunately, the first publication for the nursing competencies was actually in 2011. And we actually had a workshop, and those are the pictures for the workshop. And the competency document was on the RCN website for nearly 4 years. And then, unfortunately, they did put it down because it had actually expired. It needed to be reviewed. And this is the work that we've actually been doing the last 3 years. So we have a new document now, which I'm going to talk to you about. So I think the driving, what's happening at the moment, since the story about Evan Smith, there's a document that is called No One Is Listening. And whilst the No One's Listening document is being published, we've also are due to publish the Royal College of Nursing competencies. I think any minute now they should be on the website, fingers crossed. It's taken us 3 years, and whilst we were doing that work for 3 years, the RCN actually changed the templates of how they actually wanted the competencies to be produced. So we've been back and forth now for the last exactly 3 years, back and forth, trying to put it in the exact template and trying to make it more usable as well. I don't know, did any one of you see the original document, the nursing competencies? Mm-hmm. No? Yes? Okay. So there is a lot of things that have actually changed from the original document to the one that is going to be published soon. So like I've explained before, a competency is a tool that is used to benchmark how you actually practicing with patients in practice. And this document, it's actually focusing at every level of the nursing career. So it's from level 1 to level 8. And it looks at the performance criteria of the individual nurse, and then it has what we call knowledge and understanding. So it actually asks you particular questions about your knowledge and understanding, and then there's a little bit about attitudes and behaviors in there as well. So in the original document, there were only 10 nursing competencies. We now have 14. We also learned that from the original document, the amount of work that we put in, which was mainly focused on sickle. So this time around, we've tried to put a lot on thalassaemia. So there is a lot around the thalassaemia care. So on the original document, these were kind of the focus. These are just the summary of it, but there were 10. So the first one was assess in collaboration with the patient, their needs, taking into account the impact on their age, development stage, and their cultural and ethnic background. And the second one was undertakes comprehensive physical assessment, follows up with appropriate action, including referral to the medical specialist for relevant chronic healthcare conditions. And then the fourth one was signpost and supports patients and families, carers in their understanding of the genetic condition. And then the fifth one was develops and evaluates the self-management plan with the patient. And these are still in there, but we've structured them differently. The new ones, there's other things as well. Just if you look where it says provides specific interventions safely with regards to this, we're actually looking at skills rather than attitudes or behaviors or understanding or knowledge and understanding. We're actually looking at what particular skills do nurses in sickle cell actually need to have in order to help and support the sickle cell patients. So, for example, you've got undertaking phlebotomy and cannulation. One would think, oh, why did I actually put that on there? When we did the first workshop, we actually had patients telling us what was important to them. And what was majority of sickle cell and thalassaemia patients, what was important to them was phlebotomy and cannulation, because it's not simple. They've had their veins damaged right from the beginning of their lives. And by the time they get into adulthood, the whole body gets very sensitive. So having somebody who hasn't actually done cannulation on a patient who's already sensitive can be damaging for them psychologically. So we've put that in there as a specific competency. So you've got to have particular skills to actually do this. And then managing central venous access as well. We have a lot of our patients on devices. I think when we did the original, we were just talking about central venous lines. Now we're talking about midlines, there's more devices. So we need our nurses to be aware that some of our patients might actually have devices that you might not be aware of when you come into contact. And you've got to also have the ability to actually insert and remove those devices when required to. And then we've got fluid management and hydration. And I think it goes without saying, in sickle cell it's very important. And then pharmaceutical treatments and side effects, and uses early warning tools, approaches, for example, red alert to identify a deteriorating patient. And what's new in the new document, there is about 4 new competencies in there, so it makes them up to 14. So the first one that we put in there, transfusion and exchange blood transfusion, manual or automated. And then we've also put in there hydroxycarbamide, and that's new. And we've also included iron overload management, including chelation, and then transition, early planning and preparation. Okay. So the old framework, it was just a document that you would just read, and then once you've read it, we left it to your own devices with your own hospital to decide how you're actually going to measure those nurses. So it was just a document which was there. So I think a few years ago, I didn't actually ask many nurses how they felt. I think I sent a questionnaire asking nurses how they felt. They felt it was very difficult to use because it wasn't giving them explanation as to what it is that was expected for you to actually do with the document. So the new document, we've put in a lot of guidance and explanations of how you're actually supposed to use it. And the new thing that we've actually put in there is the level of achievement. So we've put in where it actually tells you when you've achieved it and how long it will take you to achieve the whole document. I think we've put something like 5 years to achieve every competence in there, 5 to 10 years, I'd say. So the level of achievement describes the expected competency level, and then knowledge and understanding. This section requires you to have some specific knowledge and have an understanding. So what we're asking you to do is to actually evidence. You need to evidence what it is that what you've actually read or what you've actually done with your mentor to actually get to the level of achievement. And then knows how to, this is more about skills, you know how to cannulate a patient, you know how to counsel the patient, and etc. So what we've done now in the new document, we've used Banner. I think as nurses, you all know the model of Banner. I'm sure you all know. Yes, good. So Banner is a tool, and it has 3 key distinctions between levels of competencies. It's like a stepwise scale. So it starts from novice to knowledgeable doer and the expert practitioner. So the actual competencies, we've actually separated them in that particular order. So novice will be 1, and then knowledgeable doer will probably, so if I was to give you an example, novice will be band 5, and knowledgeable doer will probably be between 6 and 7. The expert practice will be 7 and 8. That's the examples of the levels. And the old document used to look like this. So there, it doesn't actually give you where you can put in conversations you've had with your mentor, or you can put in your acquired skills, or you can document your evidence. So it was just something that you would read, and then we put in references in there. The new document looks like this, and I think it's much better. I'm much happier with it because you can now have a conversation with your mentor, and then you can document that, and you can do self-assessment as well as to where you are. Are you a novice, or you're a knowledgeable doer, or you're an expert practitioner? So if you're a knowledgeable doer, you started from level 1 going upwards. We actually have levels. So for this competence here, you've got 3 levels. So the first one, this is just the top, the first one. And then you have the second one, which is the 6 to 7, and then you have the third one, which is the advanced practitioner, which is the band 8. We also have space for you to do an action plan as well. You can do an action plan with your mentor. Your mentor can be the nurse or the doctor, depending, because it's not every department. You have, you have many specialist nurses, consultant, and so forth. So it could be a doctor that is actually doing the competencies with you. So you can actually do an action plan and plan together on how you're going to move forward, and you can document your evidence in that. I think, Emma, you'll be quite happy that during your peer reviews, you would see many nurses have their evidence of training or skills of practice. And then, so the guidance for the competencies are actually within the document. It actually tells you how to actually use it. For example, you've got skills acquisition, and this is just to ensure that nurses are able to apply theory to knowledge and practice. And another example I could give you, because I can't read, I left my glasses in my bag, is where a particular competency is not applicable to the individual, or the role indicates not applicable. No, it's okay. And then if you've met, you put M, and if you still require further skills, then you put RFS in there. And then there is expectation of the supervisor and also the individual. So they're in the document. I'm not going to read them because I want you to go online and get it and, start to do some work. So it's you agree on a SMART plan with your supervisor, and then you know what you need to do and what the supervisor is required to do. So the way forward, we've been asked by the Royal College of Nursing to update the document yearly. We're actually going to have a web page. Before it was a document. This time around, it's actually a web page. Yes. And on that web page, there's going to be links telling you where to do the courses and what the latest guidelines are. It's not just going to be on the RCN website, it's going to be on the Sickle Cell Society website, the Thalassaemia Society website, and it's also going to be on the UK Forum website as well. And the HCC. Okay, excellent. And what we need is feedback. We need you to feedback and tell us how the document is worked for you. We also need patients to feedback as well. I don't know how the patients would feedback, but I suppose it would depend on whether we have less media stories about what's happening in the nursing world in terms of sickle cell and thalassemia. So I am excited that anytime now it could be on the website. We finished everything that was needed to be done finally. We're going to be having a launching of this document on the 9th of May. We haven't confirmed the venues yet, as we're still doing the work in the background. And I just want to thank everybody who has contributed to this document. I can't list the names. The names are actually in the document, but there's so many people that have actually helped and supported. So first of all, the Royal College of Nursing, the Competency Working Group. It has been so many different nurses from different backgrounds in different clinical areas as well. That has helped me in the last 3 years. I'm almost in tears because it was hard work. And the reason why I said it was hard work, because people are finding time within their own working lives as well, just to give me support and help me put it all together. So I don't want to take credit for this huge piece of work. It was many different people that helped. The Sickle Cell Society and the Thalassaemia Society and the Association of Counsellors, Sickle Cell and Thalassaemia Nurses Counsellors, the STANMAP, the UK Forum, and everybody who's actually listed in that document. So thank you very much for listening to me.
Thank you very much. Any questions in the chat? Okay, so no questions in the chat. Has anyone got any questions in the room before we break for tea or coffee?
You just use it for CPD because there is no accreditation attached to any competencies. It would be so difficult to put accreditation in there because there's so many different things in there. Yeah. So yeah. And you can actually use it for your career progression as well, because especially if you want to continue your career ladder in Sickle, I think eventually we're going to start asking people for their competencies as part of the interview, you know. So I think you can use that to actually evidence that you've done this and you've done that and so forth. Yeah.
Probably different partnership as well. We still bite-side sessions on the resident website are available for
And just to point out that these nursing competencies are not age-specific. They're from birth until it's for
cradle to grave.
Cradle to grave. So it's for pediatric nurses, it's for adult nurses, it's for transition nurses, it's for research nurses, it's for everyone. Okay.
I was going to say, I know that you mentioned you only have 3 consultant nurses. Which seems quite disproportionate. What is your aim for
I think we've got some challenges.
Sorry, they didn't hear online.
Okay.
I know you mentioned there were only 3 consultant nurses currently. It was just really a question of the aim for sort of 3 to 5 years. How much do you see that increasing, or what would you like?
I think that's a very important question, and I think this question keeps coming up left, right, and center. I think we've even taken this question to the House of Commons. It's about the education required in sickle cell and thalassaemia. So one of the challenges that we have is that as a student nurse, you're not taught about sickle cell. It's not even part of the curriculum. So it needs to start up right from the universities, whereby we start teaching it, and once we start teaching it, then we have more nurses go into research, and once we have more and more nurses go into research, then we start to have a particular nursing ladder from bottom going up. So I'm kind of hoping that since we have now at least 3 nurse consultants, we can try and influence and see maybe in the next 5 years we can start some nursing research, which is my passion. It's something that I really want to do. I've done it before, and I'm pretty sure we can really start to research nursing care and research nursing practice and research nursing behaviors and attitude towards sickle cell and thalassaemia.
Just one last question, if that's all right.
Hi, Sekayi. It's fantastic work. The competencies are very fantastic, and it does benefit the nurses, all the hemoglobinopathy and hematology nurses. But my question is A&E nurses. Can you look into anything to do with sort of research to do with A&E nurses, because that's where we experience, I think, 95% of the problems with the patients coming in. It would be nice if we could get something for them to acknowledge, like sickle patients and how the treatment should be. Is there anything like that you could possibly look into in the future?
It's actually my next project. I already have the question, and we're going to do some work with some emergency and ward nurses, and then we're going to see if we can co-design something with the patients. So yeah.
Thank you.
Thank you very much. Thank you.
Great. Thank you very much, Sekayi. I believe it's time for tea and coffee again, isn't it?
Yeah.
So help yourself in the room next door.
And anyone online, will put the registration code back up. Please do fill it in if you're in the room.
And we'll be starting off again at 25 to...
Where's that?
start recording this, don't I?